Welcome to our final week of Faculty Perspectives for 2020. I hope throughout this last few weeks you've begun to really understand the breadth and depth of research interests and work of our top-notch faculty. We've tried to highlight the ways in which undergraduates can not only learn from faculty at the University of Oregon, but also share the ways students can be part of the huge body of research done at the UO each year. In just a moment, I will introduce you to our presenter for this session, but I can't help but to remind you of two important items. First, that our presenter will answer your questions live on camera in the last segment of this program. If you're a student watching in Zoom, use the Q&A feature at the bottom of your Zoom screen, and we will be sure that they get answered here today. Secondly, students watching should be sure to visit community.uoregon.edu after we're done with this program and submit your reflection as part of your introduction requirements. As part of those requirements, you will need to complete reflections on 10 separate faculty perspectives. What do healthcare and higher education have in common? Vice Provost for Undergraduate Education and Student Success, Doneka Scott, will discuss this in today's Week 8 Anti-Racism track right now. Welcome, Dr. Scott.
Thanks, Cora. It's great to be here today.
We're so happy to have you, and the show is all yours right now.
Thank you. First, I'd like to begin by acknowledging the indigenous land. So the University of Oregon is located in the Kalapuya-Ilihi, the traditional indigenous homeland of the Kalapuya people. Following treaties between 1851 and 1855, Kalapuya people were disposed of their indigenous homeland by the United States government and forcibly removed to the Coast Reservation in Western Oregon. Today, descendants are citizens of the Confederate Tribes of Grand Ronde Community of Oregon and the Confederated Tribes of the Siletz Indians of Oregon, and continue to make important contributions in their communities at UO and across land we now refer to as Oregon. And it's really important to acknowledge this, but acknowledgement is just the beginning. So really there's a call to action. I invite and encourage you to act. So using my framework of listen, learn, and act, I invite you to listen to the experiences of Indigenous students, staff, and faculty, and learn about Indigenous lands, languages, and treaties, but not to expect or ask Indigenous people to teach you. A great place to start, though, is with Dr. Kirby Brown's Engaged Humanities faculty perspective that if you haven't already, you should really check it out. It's really great. So once you've begun listening and learning, then incorporate what you've learned into action. And you can act today even just by beginning to empathize with the effects of colonization. So a little bit about me. I'm from Port Huron, Michigan, and I'll show you on my hand. It's right here in the crook of the thumb. I wouldn't be from Michigan if I didn't show you. And it's a small town. I'm from a very small town. I'm a first-generation college graduate and attended the University of Michigan on an academic full-ride scholarship where I majored in chemical engineering and completed a master's in higher education, higher and post-secondary education, and a doctorate in pharmacy. So I actually went to college and I never left. I continued on, and by training, I'm a toxicologist and emergency medicine practitioner. And what that means is I treated patients who have overdosed or children have gotten into medications, environmental exposures as well. And currently, I'm here at the University of Oregon. I am Vice Provost of Undergraduate Education and Student Success and faculty in the College of Pharmacy. And to be honest, I have the best job on campus. People may want to argue with me about it, but I won't accept it because my job is to ensure that you are successful. So removing institutional barriers that prohibit you from finishing in a timely fashion and successfully completing your degree. And so there's no better honor or better job for me on campus than being able to do that. Before I continue on, I want to share some guiding principles around student success for the University of Oregon. And one is that our students are our students. So regardless of what program you're in, what college you're in, what major you have, as far as being ducks and students at the University of Oregon, you're all mine, is how I like to think about it. Any student admitted to the University of Oregon can successfully leave this institution with a degree in hand, and we firmly believe that. We do not describe to the notion of student deficiency model when it comes to discrepancies in student success. The approach is rather that it's an institutional problem and an institutional barrier model. So, my job is to find whatever issues we have, if there are any problems, and solve them, anything that gets in the way of a student being successful. And then finally, student success is everyone's everyday work. So anyone that you encounter on campus, we're here for you. There's really no reason for us to convene as an institution of higher education if students aren't at the center. So that's a little bit about me and how I got here today. So I actually have the privilege of closing the anti-racism faculty perspective sessions. And before I start, I wanted to start by recapping the great and very informative sessions that we've been privy to over the last 7 weeks. So we began with Provost Phillips giving us an overview of anti-racism and a brief history of race in Oregon. That was followed by Assistant Vice Provost Johnson discussing civic engagement, activism, systemic racism in the criminal justice system. And she also talked about her debut novel, her young adult novel, This Is My America. And this is actually a fantastic book. It's a page turner, and I highly recommend it. Then we had Professor Russell, where she discussed how race relates to assistive reproductive technologies, followed by Professor McKinley, who had discussions on freedom, slavery, and, as she terms, fractional slavery within the law. Professor Cox brought to you the impact of students in sports in historical moment, and Professor Elias talked about he examined the climate threat and how the media impact the response of different racial and ethnic groups to messages about climate change. And then last week, Professor Paluto gave a riveting lecture on environmental racism and discussed student participatory research results of a project that she calls Trump's Spectacular Racism. So as you can see interwoven between all of these sessions, there's really an intersection in the work, and it tied together quite nicely. And so this will lead today to my work, but before we begin, I'd like you to take a look at this slide and just think about what they all have in common, and I'll give you a little bit of time to do that. So I'm interested in the interplay of race and culture in student experiences in higher education, and also in the practice of pharmacy from the perspective of both the practitioner and the patient. And so my scholarly and research agenda consists of two distinct but complementary foci. So the first is understanding student experiences and success indicators with a particular emphasis on access, retention, progression of underrepresented students, and also health disparities, cultural competency, and uncovering the role of practitioner implicit and explicit biases and how that may contribute to the ongoing disparate healthcare outcomes for minoritized populations. So today I'll just briefly touch on both of those, but to begin, I'll start by defining some terms. So you've heard of health disparities and throughout this session and social determinants of health, but really there are two types of health disparities. There's a health status disparity, which are the differences in the incidence and prevalence of disease, disability, or illness that result in worse outcomes. And these differences can be among racial and ethnic groups, gender groups, different social economic groups, and other groupings. But then there's also healthcare disparities. And those are differences in the quality of care due to clinically appropriate treatment decisions and patient preferences. So you can still have those differences, and it can be a dissimilarity. And a dissimilarity it refers to those differences that aren't attributed to injustice or fairness. For example, if a well-informed patient chooses not to accept inappropriate treatment, then this would lead to a dissimilarity as opposed to a disparity, which are differences that are indicative of injustice or unfairness. So, when we talk about disparities, we're talking about real lives that are affected. And so when we talk about that, who actually is affected? I will use two examples from areas in which I've practiced to showcase how disparities in health present. So this first study are results from a study on emergency department in the analgesic treatment in the emergency department in New York City, in part of New York City. And really, it was a study around isolated long bone fractures. And with those fractures, just to be clear, it hurts. They hurt really bad when you fracture one of your long bones, such as the tibia, the femur, or the humerus. Dr. Russell mentioned in her session and talked a little bit about how Black patients are undertreated for pain. Well, in this study, we really looked at the white patients versus Hispanic patients and what they found and elucidated in this study to look at the ethnicity as a risk factor for inadequate emergency department analgesia. So when compared to white patients, Hispanic patients in the emergency department were more likely to receive no analgesia or less likely to receive narcotics to treat their pain. In the next study, in the failure of pharmacies to stock opiate analgesics, again, in this study, we don't carry that failure of pharmacies in predominantly non-white neighborhoods to stock the analgesic. So in these New York City neighborhoods, as they became increasingly diverse, the number of pharmacies available and access to opiates diminishes significantly. And so this is problematic for a multitude of reasons, but the effects on not having access to, one, pharmacy to get your medications, and two, the actual medications that you need to treat your pain is an additional burden on those in the neighborhood, so the patients that are in the neighborhood, and is problematic. And so as you can see on this slide, the percentage of pharmacy with adequate opiates, they increase as the populations become less and less diverse. And then you can also see it on this slide as well when we look at our Hispanic and Asian populations as well. So there are many indicators. So these are two examples really from areas that I've worked in, but there are many examples in nearly all indicators of health. You can find disparities in patient outcomes. So whether it's chronic illness, so asthma, cardiovascular disease, hypertension, diabetes, HIV, things as far as transplantation, like renal transplantation, prescription medications, use of diagnostic services or prevention services, length of stay in hospitals, cancer diagnosis and treatments. So there are multiple things. And then the one thing that we can add to the list is with COVID-19. So I recommend reviewing or viewing Dr. Kristen Yaris's faculty perspective on COVID-19. And there she really talks about the disparity, and she delivers an in-depth account of social determinants of health and the disparate outcomes of those patients. So it continues, and we talk about the reasons for that to happen as well. So the big issue that is happening is, why should we care? By 2045, the U.S. will be a majority minority, so by sheer numbers, there will be an increase, and this issue will be exacerbated. This also poses a moral and ethical dilemma that will be amongst one of the most significant challenges of today's rapidly changing health systems. Also, healthcare is tied to social justice, to opportunity, to quality of life for individuals and groups, as well as racial, ethnic, and gender disparities threaten to hamper the efforts to improve our nation's health. These disparities poses a significant dilemma for the society that is still wrestling with racial discrimination, as we can witness about what's currently happening in America. And then the cost has a significant implications for overall healthcare expenditures and the quality of care. But ultimately, why should we care is because, quite frankly, people are dying. In a perfect world, with this graph that you see here, in a perfect world, there would be one line and all people would fit on that one curve. But that's not the reality of how we live. So depending on who you are, there are differences in survival rates, and also the life expectancy of the different groups. So while the average life expectancy in the U.S. has increased since 1970, Black males have the lowest average life expectancy, and their life expectancy peaked at around 2014 and has been decreasing and declining since then. In contrast, as you see at the very top, white females' life expectancy had already exceeded 70 years back in 1970, and has continued to increase over time. So at the beginning, I had you look at some pictures so that you could think about what all of these people had in common. Really, you can see that they are Black, they're male. You may not know some of them, but they're entertainers, they're affluent, but they're also dead. So they have died by causes that disparately affect African American men in their early stages. And so if you were, as you think about and you were looking, if you were raised in the US, we've been conditioned to categorize people, and research has bared out that when you see someone, you think about race first, or you categorize race first, gender second, and then age. And that's why it's so important to understand the implicit and explicit biases of healthcare practitioners as it relates to patient care outcomes. And it is a point where we can mitigate the effects. So as you see in commercials, wait, there's more. So this is health disparities in general, but there's more to talk about, because we can't talk about health disparities without discussing other social factors that contribute to overall health. So these three factors really are wealth, the criminal justice system, and education. So I'll talk a little bit about each of them. As you can see in 2016, there's a large disparity in median wealth in the U.S., an average difference of $143,000 and $140,000 for Black and Latinx families, respectively, when compared to white families. And that's just breathtaking. And while there's been median increases of wealth over time for all groups over the last 3 decades, the same is not so for Black Americans, in which there's been a 50% decrease in wealth over that same amount of time. In addition, the percentage of Black and Latinx families with negative debt far exceeds that of white families, which this shows you. And this signifies that the value of their debt exceeds the value of their assets. And as we know, wealth is tied to health. And then also there is the component of insurance, or the ability to have access to health care. Also, to briefly talk about the criminal justice system. So the Black Lives Matter movement of 2020, which still has Black Americans and allies taking it to the streets every day since the murder of George Floyd, is an indictment on the disparate criminal justice system. AVP Johnson discussed the criminal justice system at length in her session. And, as she noted, she actually wrote a book about it. These next set of slides provides data to underscore the problem and the associated bias inherent in the system. So even though Blacks comprise of about 12% of the general population, they are about 33% of the prison population, and are definitely overrepresented. So in contrast, 46% of our population are white, and then 30% of that population in prison are white as well. So we're already starting with a disparity in the prison population. This depicts how Black people are disproportionately serving sentences of life without parole, and virtual life. And you can see that the trend is repeated. Also with overrepresentation of prisoners on death row in comparison. So, kind of the same trend lines that you can see throughout. The next two slides really looks at the intersection of incarceration and wealth, so that we could tie those two together. And this particular slide looks at unemployment. And so for people 35 to 44 years of age, while being incarcerated has a negative impact on employment for everyone, it's disproportionately affecting Black men and Black women. In this graph, we look at incarceration and wealth accumulation. And of note, these are the accumulation of young men and race by ethnicity. There are significant differences in the outcomes. White men who have been incarcerated are still accumulating more wealth than Black men who have never been incarcerated. So you can see this common theme. You can also see it repeated in education as well. So again, in a perfect world, we would have one bar and everyone would fit and have the same, but that does not work. And so this is graduation rates for public high school students. And then again, 6-year graduation rates for bachelor's degrees. You also see a difference there. And then the overall percentage with respective race and ethnicity of adults 25 and older that actually obtain and have a bachelor's degree in higher degree. You can see a difference in that as well. So again, what we're doing for health disparities will ultimately fail if we don't take care of and think about the other things that impact health, which are wealth, criminal justice system, education, and a host of other factors, right? And so these are some of the grand challenges of our country. And the great thing about it at the U of O is when you come and you are educated here, you will actually gain the necessary tools and education you need to really be courageous leaders and tackle some of the grand challenges. So this is something that will be multi-generational for us to be able to fix. And we count on you coming through to really be able to help us make that happen. So with my remaining time, I would be remiss in my duties as closing the anti-racism track and in my role as leader of student success on campus if I didn't discuss the concept of equity. So I'm framing this in the realm of higher education, but it applies across all institutions, industries to address all of the isms. So equality, when people say equality, it imagines a world, an equal world. I care about all students equally, right? But what we know is that the world isn't equal. So we have, for this example, students starting in different places. There are some students who come, they have scholarships. Their parents, their parents were educated, so they're not necessarily first generation college students. There are tutors for the exams to come in, and all of these things that really put them on a higher level than some others. And then there are other students that may have some and not the whole complement. And then we have students that don't really have access to any of the things that help boost. And some of those students come from poorly funded schools. They have less skilled teachers. Their counseling ratios are quite large, and their curriculum is truncated in some way. So with the equity lens, we have to understand and realize that there's bias and systemic racism within the education system. And so while there's a ladder, it can be broken and even harder for someone to be able to scale that ladder, whether it's microaggressions, implicit bias, disproportionate remediation, and then there are true differences between those. when we talk about diversity, we normally focus on bringing in more students, but it's still in an unequal path. So we say, let's increase diversity. So we do that. But if we haven't done what we need to do to ensure that they're successful, it just means we have more folks that are here and available when in the system is still broken. And so that's why the goal really is equity. So in contrast, equity redirects resources to pathways of greatest need to fix the barriers and intentionally provide support. So what you see there is how do we support our students and help to fix the ladder so that they can excel for their degree as well. And at the University of Oregon, we really are striving to make our institution more equitable in higher education. So what I want to leave with by saying is that, in conclusion, I emphatically state that Black lives matter. It is literally impossible for all lives to matter if Black lives don't matter. Thank you. I will entertain questions, Cora.
Thank you so much. In the last few days, I'm sorry, the last few days have been particularly trying, I know, and I hope that you are well, and I know that you're from the Midwest, and so it's probably even more so troubling. And I guess I want to ask you, particularly around your role here as the Vice Provost for Undergraduate Education and Student Success, the ways in which we can support students who truly want to be part of the solution. I know that I supervise students who are out marching and are part of the movement, the Black Lives Matter movement, and working hard toward equity as part of what they feel is a civic responsibility to the greater good. How do we at the University of Oregon have the opportunity, and how do we support students toward those goals?
Mm-hmm. Yeah, so, the major thing, I've developed the framework of listen, learn, and act. So that's one thing. So to be educated, we're in an institution of higher education. So we have the opportunity to learn and to really listen and to not just to stop there, to act. Mm-hmm. And so for our faculty, for our staff, for our students, it's really understanding the issues and then seeing where you can be part of the solution. And so at the institution, we've done many things to really try to support our students in ways that are most important to ensure that they're successful and that they're retained to actually receive their degree. So we have everything from trying to help students become academically and socially integrated into the institution. We most recently launched our BCC, which I know we've had the conversation about. Our Black Cultural Center, which is great, which is new. We have financial ways to help students to progress. There are lots of student groups and activities for connections, but also we have different departments throughout the institution that help student populations specifically. So that's everything from CMAE, which is our Center for Multicultural Academic Excellence Center. We have our Multicultural Center. We have centers for our veterans, for our men, so we have a whole kind of gamut of support in that way. We have majors that students may find interesting, and then they can learn more and be able to major and minor. We are just launching the Black Studies minor, which is new, that's really exciting. So as an institution, we're trying to move things forward to fully support our students. We are increasing our number of faculty and staff on campus through hiring, because it's difficult to come to an institution if you don't necessarily see people that look like you. And so we have faculty and staff that are here, but we are increasing those faculty and staff as well. So there's this really large initiative to identify the issues of the institution and fix them, as we've said. So,
thank you. Okay, so a couple other questions. What do academic advisors on campus do to serve Black, Indigenous, and people of color?
Mm-hmm. So we have, first of all, it's coming into the interaction with cultural competence and understanding the background and needs of students in general, but not in a generalized way, but not in a stereotypical way, because everyone is different, but actually having that understanding. We have multiple staff on campus dedicated to specific needs of our students. So in CMA, we have, for example, we have advisors that specifically kind of support our Native students. So we have advisors in that way, generally speaking, and continue to hire in those realms. And so there are different pockets across campus that we have advisors, and we hire specifically for students so that we can meet their needs.
Thank you so much. Jacob wants to know, what organizations are you part of on campus?
On campus?
Yeah.
Oh, wow. So I kind of have my hands in everything. And basically in my role. So I work a lot with advising, academic support and tutoring services. We undergraduate research opportunities in those ways. The accessibility is also in our area. First year experience, which is really important. So everyone who's coming in the fall, I hope that you have signed up for either an ARC or a FIG, because that really helps your first year experience. And I do a lot of work administratively to just ensure that students are really being taken care of on campus. And so I have close relationships with virtually every unit on campus.
Thank you. Mary wants to know, how can equity be practiced by students virtually, whether that is in the classroom or around others?
Mm-hmm. Yeah, that's a great question. It's especially in the virtual environment, is one, just when you approach that, understand that all students are coming from different realms, and how they present themselves on camera or in the classroom could be different. So you may have students who don't show their face, or or that they do, but there could be multiple reasons. So I think in general, I would say having grace and compassion is a great place really to start and think about how you support. But I think it goes to also not tolerating, if you hear something that is a microaggression, to call it out in a way that makes sense in the moment, and not do that. I think a lot of times when our underserved and our underrepresented minoritized student populations are experiencing this thing, sometimes it's that they feel alone because they don't have allies who are going to come and speak out against the injustice, and it becomes really taxing, right? Mm-hmm. It's taxing and is exhausting to have to encounter these things every day. But when you have allies that can help, it's really helpful.
Thank you. How else is the university working to address equity in student success?
Mm-hmm. Yeah. So the major initiative that we're really taking on is, how do we close the opportunities gap? So there are, I had one slide where I talked broadly about the differences in graduation rates between certain groups versus either the institutional average, or if you compare them to our white or Asian students. And, gaps aren't acceptable. So again, I come from the frame of, if there's a gap or something's not right, then it is on the institution to figure it out and to solve the problem. It's the onus really isn't on the student. So the major thing is, and we are really using data to better understand our students and the needs, identify what the potential issues are going to be, and solve those problems, right? So in doing it in a very intensive way to eliminate those gaps, because again, I believe that any student that enters into the U of O can graduate, leave this institution, but with their degree in hand. So my job is to ensure that happens and to make that happen. And so that's where we are. So that's one of the major initiatives that we have. We also are looking into kind of the financial piece, because many of our students stop out because of finances. So, how can we help students meet the needs so that they're able to remain enrolled in school?
Thank you. What led you to study toxicology in emergency medicine?
Ooh, fun question.
Yeah.
So as I was, so I'm that type of person. I'll just say I'm that type of person. So as I was going through, through pharmacy school, you kind of go on multiple different rotations and, in clinicals and figure out what you're going to do. And at that point, I had experience in emergency medicine and just loved it. I'm more of a consultant, so I have more of a consultant mindset, and so toxicology was great for me because what happens is, a patient comes in, they call me, I go, I see the patient, I give recommendations, and then the treating physicians then take those recommendations and treat their patients. So that's where I had my comfort level in just really having a broad knowledge base about toxicology. I mean, when I found it, I just loved it. So I don't even know how else to explain it except toxicology emergency medicine found me.
Yeah.
And it's the same thing with students. When you come in, you may have an idea of what you want to do, but then you start taking courses and you start learning about different areas that you didn't even know existed, and then the next thing you know, you're in love. So when you come in, just use the opportunity before you declare a major to explore, but explore intentionally, because I don't want you on a 10-year plan. I do want you to explore, but I want you to be really intentional about that, and then find things that you love. That's the great thing and the privilege about being able to continue on in higher education, is just really just the knowledge that you can gain by being in a higher education institution. So as you can tell, I came and I never left. It doesn't get better than this.
Well, one of the nice things about the part of the university that you oversee with the advising is that often when a student has passions and questions and is thinking about 10 different kinds of things that they're interested in, an advisor can help them narrow in on a class or two or a major, and so that they're not on a 10-year plan, right?
Yes, exactly.
Okay, so before we started this afternoon, we were talking about some of the amazing questions that we're getting from some of our students. And,
Yes.
And we talked specifically about this next question asker. So Sophie is wondering, is there an anti-racism research going on in every major that so all students can participate? And what are the best anti-racism programs that you personally recommend to be involved in at the UO?
Okay. And I didn't catch all that, but can we just pause for a moment?
Yes.
So I can say, let's pause a moment for Sophie. Because Sophie, you have been knocking it out of the park the entire session. You're bringing great questions, and so I appreciate that question, and I can't wait to meet you this fall. So I couldn't hear all of it. Can you just repeat that again?
Yes, it's a multi-parter, so I'll ask the first part first, and then we'll get to the second part. How's that? Is there anti-racism research going on in every major so that all students can participate?
Okay. So I'm going to gather that there aren't anti-racism research that's going on in every major, but the nice thing about the institution is if you find someone who's working on any issue that you like, you can, ask to be a part of that. There are research experiences that you can have cross-major, cross-college involvement in. So those barriers and doors aren't there. We have this, our Center for Undergraduate Research and Engagement, which is also in UESS, and this center is there just for that. It helps connect students to faculty and researchers of interest. So what I would recommend is that if you're interested in something in particular, to be in contact with the center and let them help you find those opportunities.
All right, so second part of Sophie's question. What are the best anti-racism programs that you personally recommend to be involved in at the University of Oregon?
I would say there we have Iris as a major and department. We have the new Black Studies minor that's coming in, and it's taking those courses and it's being involved in the student groups that really work and do that work across campus. And I think Iris is a great place to start within ethnic studies to further interrogate these issues. I think we had a great example with Professor Polito on some of the work that actually happens in the classroom. When she finished speaking, I was like, can I go back to school? I want to take this class. So they're doing some really great work there, and I would direct you there first and talk to some of the faculty. Faculty are available in here to help guide students in their interests, so I would start there.
And just FYI, Iris is Indigenous Race and Ethnic Studies. That's the department. Dr. Polito, that's one of the departments she works with, and others that we've had throughout these faculty perspectives. I think it also is important to know, I think one of the things that we've tried to illustrate all summer is that there are courses within departments like Iris where they are part of the core education curriculum at the U of O, and they can enhance any major, right? Mm-hmm. So an education major can benefit, and political science major, but also a biology major or a math major can benefit from taking courses in a program like Iris. So there's so many ways to enhance the learning that you're doing regardless of your major.
Definitely.
Okay, so Brian wants to know, how can I be involved and be an ally of the Black Lives Matter movement in the fall while I'm taking classes?
Yeah, so great question. We have opportunities with ally training across campus for our faculty and staff, and as well as our students. So that's a great place to start, and just really just being an ally. So that means, coming into those spaces with an open mind and the willingness and ability to help in ways that whatever particular place that you are, that you're willing to help in the ways that they need the help. So a lot of times it's humbling yourself, coming into the situation to actually receive some direction on how a particular group would like for you to share an allyship. So that's one thing. And I think the other key, and it's been said a couple of times too, is is in the education part of it is making sure that you're doing your work to become educated on the issues and not asking that particular group to teach you, because that becomes exhausting. And then the best thing that you can do is to do some research and education on your own, and then help in that situation, but not have the belief that people are going to teach you. And what's nice when we come in the fall is we have a student group for everything, right? And even if we don't have a student group, and if you like it and want to do it, you can find 4 more of your friends and start one. So, there are so many opportunities to really be engaged and at the institution that I really recommend it, and I highly endorse it.
Thank you so much. Okay, so we're just about out of time. Audrey wants to know, COVID-19 has exposed healthcare disparities due to race, class, wealth, etc. What actions can we take as patients to hold our healthcare providers accountable for reducing their implicit and explicit bias now and in the future?
Mm-hmm. Mm-hmm. So I hear two parts in that question. One, we'll talk about kind of the spread of COVID-19, and so it's the healthcare practitioners as patients is understanding what the health disparities are, and so if you have a particular ailment, right, understanding what that is and maybe how it's treated throughout, so you can ask pointed questions, right? And especially for our patients who traditionally have been disproportionately affected by health disparities, if knowledge is key, right? So you come in and and if you know what traditional or the treatments you're supposed to receive, and if you're not getting them, and it's not being recommended, asking those questions. But the first thing is to actually know. Mm-hmm. So if you're diagnosed with something or you have something, you have to do your research, and you have to know what best practices are, so that if something sounds if something doesn't sound right, then you can ask those very pointed questions, is helpful. Another, I didn't talk about social determinants of health because it's in two different areas and I knew I was going to run out of time, right? But part of that is also health literacy. So we have a lot of patients who, they don't understand the healthcare system, and they don't understand necessarily the treatments or what's supposed to happen for their particular disease or ailments. And that in itself, too, is problematic as well. And there's a disparity within health literacy, too. So I think it comes down to education and knowing. So if you approach the interactions with your healthcare practitioners with knowledge, it goes such a long way.
Thank you for that. That's all the time that we have for questions.
No.
I know. You want us to
What?
hear all day, but we want to make sure that we give our students a chance to go to community.uoregon.edu and reflect on this program and tell us what they've learned. We're really excited to read what they write about your program and the entire anti-racism track. We're at such a critical moment for students to be really reflecting on the things that they have learned all summer. So do students make sure that you go to community.uoregon.edu and submit those reflections on this program. If you have questions about this or any other introduction program, please visit our website, orientation.uoregon.edu. I encourage you while you're on that website to make sure that you navigate to that next steps link at the top navigation bar, because you have a few other items to make sure that you take care of to be prepared for fall term. And so we want to make sure that you take care of all of those things. You can email us your questions at orientation@uoregon.edu or text us at 541-346-1159. Again, for you students, thank you so much for your time watching with us today. And to you, Doneka, thank you so much for helping our new ducks prepare for fall term.
I can't wait to see you guys in the fall.